This is the Fix Your Sciatica podcast.
What is the purpose of exercise? To build strength and condition and muscle for improved function. So when it comes to doing exercises for sciatica, the main purpose is to build up the strength in muscles that are weak that may be contributing to the sciatica pain. Unfortunately, in the age of information, you'll see countless articles of the best exercises for sciatica. Some of them are helpful, but some of them aren't, and some of them are just painful. The reality is that the exercises that help your friend or neighbor may not be the same exercises that can help you recover from your pain. So how can we figure out how to find the best exercises for sciatica pain? This episode answers exactly that question. So this is how we're going to break it down. First, we need to talk about some of the areas that are commonly looked at as weak or may be contributing to your sciatica pain. Next, we're going to talk about why these muscles can get weak in the first place. If we can understand the cause of the weakness, we can then determine which exercises would be the best to strengthen them. Lastly, we're going to talk about dosage, or how much and how often you should be doing these exercises. By the end of this episode, you're going to have an idea on how to formulate a strengthening plan for your recovery. Some of the areas that can often get considered weak include the glutes, back extensors, the core, and one area that I find to be often overlooked are the hamstrings. The next question is, why would muscles get weak in the first place? Do they just decide to stop functioning, or are there other reasons for this to happen? Muscles lose strength for many reasons. One reason is atrophy. In the presence of injury, muscles may actually atrophy or stop working as a result of protecting that joint. You'll see this in a lot of low back extensor muscles. They will actually atrophy and stop working in folks who are dealing with long-standing chronic low back pain. There is, in fact, some fatty infiltrate or tissue that actually prevents these muscles from functioning optimally. Strengthening these muscles can be helpful in improving pain and function. Now, exercises that can help with back extensor atrophy would include stuff like back extensions, Superman raises, Roman chair extensions as well. Now, I'm a huge fan of doing the good morning exercise because it allows you to hinge at the hamstrings and hips while also strengthening the low back. You see, the low back extensor muscles are more of a stabilizing muscle rather than prime movers. So it's important that we actually focus on improving the contraction strength with a focus on preventing movement at the back and promoting movement at the hips. With a good morning stretch or exercise, you can simply stand with your feet underneath your hips, toes pointed forward, and slightly bend your knees. Place your hands behind your head and focus on driving your hips straight back as you hinge your torso forward. It would look like you're closing a car door with your butt, or you're doing an awkward bow. But when done correctly, you're going to notice that your hamstrings are doing most of the work, and you're going to feel a great contraction in your abs. If you don't focus on pushing the hips back and let your chest down. A link to actually how to do this movement is going to be found in the show notes. One reason of weakness that often gets overlooked is what we call neurogenic weakness. And that is when the nerve is so irritated that the muscle actually becomes weak. This weakness is actually present with hip flexion, knee extension, knee flexion, heel raises, and great toe extension, simply giving a thumbs up with your big toes. During this time, the nerve is so irritated that the electrical signals from the brain cannot effectively travel down the spinal cord into the nerves into your muscles. And simply trying to work these muscles when the nerve isn't functioning well doesn't really help much. We need to find out why the nerve is irritated in the first place. Usually it's due to an impingement at the level of the back or the hip. If your pain is a result of a herniated disc, or you respond positively to a backwards bend, then a simple back bend or back extensions can actually improve your pain while improving your strength. You're going to be able to see if your pain is caused by nerve irritation, change your strength for better or for worse quickly after doing a stretch or an exercise. If your pain is a result of arthritis, spondylolisthesis, spondylosis, or respond positively to forward bending, then a simple rounding forward can actually improve your strength. Again, you're going to be able to see these changes pretty quickly if your nerves are irritated.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
Another reason muscles get weak is that they are in a super lengthened position. Now, last week we talked about how muscles can fluctuate between a shortened and lengthened position. When a muscle is stretched out, say for example with an anterior pelvic tilt or your butt is out, the piriformis muscle can be lengthened. And as a result, when the muscle fibers don't line up perfectly in the piriformis muscle, it does not have the opportunity to generate enough force, hence they're going to seem weaker. A great way to strengthen the glutes, in a way that I find way better than clamshell, is the squat, with an emphasis on pushing out the knees. So if you position your feet about shoulders width apart, slightly turn them out no more than 10 and 2 o'clock, when you sit your hips back and down to squat, you're going to push your knees out so that the thighs are running in line with the second toe of each foot. You're going to notice that the weight's going to be distributed onto the outer edges of your feet. Your squat will be much stronger this way as well. Muscles can also be weak when they are in a shortened position. When you're dealing with the posterior pelvic tilt, the glute muscles are in a shortened position. In a way, in this position, the glutes are kind of like in a clenched position. And when they're shorter or clenched, the muscle force is also weaker. Unfortunately, trying to strengthen a muscle that is already in a shortened and clenched position with more contractions may actually be counterintuitive. Trying to clench with a clenched fist will actually lead to more pain and dysfunction. What you need to do in this situation is the exact opposite of trying to strengthen the muscle. You need to stretch them out in the first place. So if your glutes are consistently clenching, it wouldn't make sense to do more of a stretch like a glute stretch, a knee to chest stretch, to actually alleviate that pressure, and then that glute will function a little bit more effectively. And the last reason of why a muscle could be weak could be simply just disuse, where you simply stop using that muscle. This can be due to habit, injury, doing things with improper form. It would make sense in this scenario to strengthen the said muscle group so that they can function better. So take, for example, bending over and picking something up off of the floor. Typically, people would round their backs and use their back extensor muscles to do the work. However, in some cases, this can be painful for folks. And as a result, the hamstrings aren't working as well as they should. And as a result, they are weak. We need to be able to move without pain and fear. But in order for us to do that, we need to test out and see how we can move efficiently and effectively, hence good form. You can break free and pass those fear avoidance behaviors by trying out these motions. But if you aren't confident to do them on your own, you can absolutely do it under the supervision of a professional, a physical therapist, someone like me, a personal trainer, a chiropractor, so you can actually ensure that you're doing these movements correctly. So let's talk about dosage, or how much and how often should you be strengthening these muscles. If we're talking about pure strength, we're looking at 3 sets of 5 to 10 repetitions, and that should be sufficient. If we want to improve muscular endurance, you're going to be looking at increasing the sets of 10 to 15 repetitions. Now, all these muscles need to actually have rest in between sessions to build their strength. As a result, expect to do any strengthening exercise about 2 to 3 times per week. Strength is a very important component to healing. We need strength to do activities, and it's also very protective. You're going to notice that strengthening muscles will be helpful if you feel immediate improvement in your symptoms and function. Remember, pain management is not a one-size-fits-all strategy. And as a result, you need to look within to see which exercise actually works for you.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.